Today I examined a 72-year-old patient who had vertigo when changing body position. I'm now performing the Dix-Hallpike maneuver on the right side. The patient is in position and I'm watching for Nystagmus. In this position, nothing happened, so I brought the patient back up to sitting. Now I'm getting ready to do the Dix-Hallpike maneuver on the left side. Now I place the patient into the left Dix-Hallpike position and keep watching her eyes. After a few seconds, a sudden burst of Nystagmus appeared. An upbeat Nystagmus with a torsional component to the left. This matched the left posterior canal BPPV. So I decided to perform the Epley maneuver to treat it. Next, I move the patient's head for the second part of the Epley maneuver. After 2 minutes, I move the head into the third position of the Epley maneuver and keep the patient in place for another 2 minutes. After completing the Epley maneuver, I bring the patient back to a sitting position and gently tilt her head forward. Then I let her rest for about 20 minutes. Next, I perform a controlled Dix-Hallpike maneuver on the patient's left side to confirm the results. After placing the patient in the left Dix-Hallpike position, I watched her eyes, and unfortunately the upbeat Nystagmus with a left torsional component appeared again. Thus, the problem has not been resolved yet. I decided to repeat the Epley maneuver for the left side once more. Now, I'm preparing for the next Dix-Hallpike on the left side to see what happens after the second Epley maneuver. After positioning the patient into the left Dix-Hallpike position, the upbeat torsional Nystagmus appeared again, which means the 2 Epley maneuvers didn't work. So I decided to rethink my approach and perform the Bascule maneuver in the RAL plane, which is right anterior, left posterior. I pivot the patient from side to side a few times, holding each position for about 20 seconds, while I watch her eyes closely, and then we will see how she responds. Unfortunately, you couldn't see the nystagmus because I wasn't using the video goggles at the time, but at a certain moment during the Bascule maneuver, I noticed a brief paroxysmal nystagmus, an upbeat torsional movement to the left. This suggested the otoliths in the left posterior canal might have started to shift, which was a good sign that they were no longer stuck. In that moment, I planned to repeat the Epley maneuver. After the 20-minute break, I performed the controlled Dix-Hallpike maneuver on the left side. After a few seconds, nystagmus appeared, but this time it was slow, vertical, and moving towards the lower eyelid. This was a good sign because it suggested that otoliths were moving along the posterior canal, likely close to the posterior arm of the left side, near the common canal junction. I stopped at this point because the patient was tired, and I suggested a follow-up in a few days to recheck. When I saw her again after a few days, I began with a Dix-Hallpike maneuver on the right side. After a few days, to my surprise, I saw an upbeat torsional nystagmus to the right during the Dix-Hallpike on the right side. So I decided to proceed with the Epley maneuver on the right side, and I performed it step by step. After performing the Epley maneuver on the right side and letting her rest for about 20 minutes, I checked the results and began another Dix-Hallpike maneuver on the right side. In the Dix-Hallpike maneuver on the right side, nothing happened. Her eyes stayed stable and no nystagmus appeared. It looks like the issue with the right posterior canal is fully resolved. Now I'm checking the Dix-Hallpike maneuver on the left side. The recording shows no characteristic nystagmus for the left posterior canal, so it looks like the issue has been fully resolved. Just to be completely sure the otoliths are stable, I also performed a separate roll test for both right and left side to confirm that everything is alright with horizontal canals. I confirmed that everything was fine and the horizontal canals were clear. To sum it up, the patient had a resistant refractory form of BPPV affecting the left posterior canal. After two failed Epley maneuvers, it was finally resolved with the Bascule maneuver. Additionally, the right posterior canal was also affected by loose otoliths, but it resolved quickly after just one Epley maneuver.